And here you see real patients and what their comments are. And I love the one at the top that Felicia states where that people just say, you look fabulous, and nobody knows what you've done. Men are enjoying this product too. And when there's been something that's aging in your face that's bothering you, having that corrected can make you feel much more confident as you go about your activities every day. Here's a young patient, Angie, who says that she's feeling more vibrant and young. Another patient who says that the appearance is really natural, and a third who is happy to look more rested. This is the patient on the top. I think is one of the oldest patients in these slides. She's 56 years old, and she's really happy, as she states, with a natural looking improvement and a youthful look to her face. Mario says he started smiling because he looked so good. And the last patient probably had some kind of moderate correction, but also notices that people find that she looks great, but they cannot pinpoint what she's done. There's no signs of artificial augmentation with the RADIESSE product used properly. Okay, this is some information about the studies that were done for FDA approval. And again, some of the warnings that patients may have redness, bruising, or swelling related to their RADIESSE injections. Bruising is unusual with the smaller size needle that we can use now that we're mixing the product with the local anesthetic, which thins it out and makes the injection actually much easier for me to do too. And redness and swelling can occur, but that usually resolves within 48 hours or sooner. There may be unevenness or firmness in the area of injection. Sometimes patients can feel the RADIESSE when they touch the injected areas with their fingers. That feeling usually resolves within a week as the product softens up and becomes incorporated into the area. And again, there may be a risk of infection, but that's exceedingly small.
Dr. Lee, we had a couple of patients that signed in a little bit late, so if you can go over a couple of recap questions, such as how long does the product last, are return visits necessary, and what is the downtime?
Okay, so the product lasts up to a year. And most of the time I tell patients that they can expect 9 months to a year of persistence. They do not need to come back in and see me unless they have questions until they feel that they need more. There's not usually follow-up done here unless they want to see me, in which case we're always accessible. And the last part of that question was? I've forgotten.
What is the downtime for such a procedure?
Right. I generally recommend to patients that when they get their first injectable done, that they plan to do it, say, on a Friday when they're going to have the weekend off, just to see how they feel. Again, the major thing that causes a downtime would be bruising, which is unusual. And I like patients to try the first time when they have a couple of days off. But in fact, most of my patients come in and go to work the next day.
Great, and we're getting a lot of questions, so keep the questions coming and we'll address as many as possible before the end.
Absolutely.
Here's a question, Dr. Lee. Can RADIESSE be used in the lips?
RADIESSE is not FDA approved for use in the lips, and personally I would not use it in the lips, no.
Okay, great. Thank you.
Any other questions?
Not at the moment now. Asking a clarifying question as we speak.
Okay.
Okay. And if you want to go ahead and go over the special.
Sure. So because we're thanking you for spending some time with us and hopefully learning something, we are offering to all attendees a $75 discount off each RADIESSE syringe that you receive. So if you come in and you need 2 syringes of 1.5 cc's, you'll be getting $150 off the treatment with the 2 syringes. So we're hoping to encourage you to go for the fullest correction that you need, and we're offering a little discount to enable you to do that. So there is a time limit on this procedure. We need you to call the office to book by November 13th, but we will perform the treatment so booked up to November 30th. And I want to thank you all for joining me.
Thank you, everybody.